Normal heart rate of different age groups. Why heart rate is different in different age groups. A normal heart rate varies with age due to several factors, including the size of the heart, metabolic rate, and the body's need for oxygen. Generally, younger individuals have higher heart rates than older individuals. Let's discuss it in details. Heart size. Infants and young children have smaller hearts relative to their body size, compared to adults. Smaller hearts need to beat faster to circulate the same amount of blood. Metabolic rate. Younger individuals generally have a higher metabolic rate, meaning their bodies need more oxygen and nutrients to function. This increased demand requires the heart to pump faster to deliver oxygen and nutrients to cells. Growth and development. As children grow, their heart size increases, and their metabolic rate gradually decreases. This leads to a gradual decrease in resting heart rate with age. Activity levels. Children tend to be more active than older adults, and their heart rates will naturally increase during activity. Here's a breakdown of normal heart rate ranges by age. Premature newborn, babies born at less than 37 weeks. A premature newborn's heart rate is typically faster than that of a full-term infant, and tends to decrease as they mature. Initially, a premature baby's heart rate might range from 120 to 170 beats per minute, potentially dropping to a more typical range of 90 to 130 beats per minute as they approach full-term gestational age. Bradycardia, a slower heart rate, can also occur in premature infants. Premature babies may experience bradycardia, a heart rate below 100 beats per minute, which can be associated with apnea, pauses in breathing. Newborns, babies aging up to 1 month. A neonate's heart rate, typically measured in beats per minute, can range from 100 to 150 beats per minute. Normal ranges vary based on the infant state, awake, asleep, active, with awake heart rates usually between 120 to 160 beats per minute. Increased activity or crying will cause the heart rate to increase. Heart rate typically slows down during sleep. Infants, babies aging from 1 to 12 months. A typical infant's heart rate while awake ranges from 100 to 150 beats per minute for first 3 months. Then it decreases to 80 to 120 beats per minute. This can vary slightly based on the infant's age, and whether they are asleep or awake. Toddlers, babies aging from 1 to 3 years. A normal heart rate for toddlers generally falls between 70 to 110 beats per minute. This range can vary slightly depending on activity level and individual factors. Preschoolers, child aging from 3 to 5 years. The normal heart rate for preschoolers typically ranges from 65 to 110 beats per minute. This is slightly higher than the heart rate of older children and adults. School-age children, from 6 to 12 years. For school-age children, the normal resting heart rate typically ranges from 60 to 110 beats per minute. Adolescents, aging from 13 to 18 years. For adolescents, a normal resting heart rate typically ranges from 60 to 100 beats per minute. This range is consistent with adult heart rates, according to medical sources. While this is the general guideline, individual heart rates can vary based on factors like fitness level and overall health. A heart rate consistently outside this range, especially if accompanied by other symptoms, may warrant a consultation with a healthcare professional. Adults. For adults aged 18 and older, a normal resting heart rate typically falls between 60 and 100 beats per minute. However, this range can vary slightly depending on individual factors like fitness level, age, and overall health. Athletes, for instance, may have resting heart rates below 60 beats per minute.